get a weather break for tomorrow's activities, but we'll go into that a little more in a minute. But I want to thank everyone for your support, continuing support. This is kind of the renewal time for GMS. If you haven't renewed, I've got forms here and journals to hand out, but most of the people I recognize their name coming through. Steve and I have been processing the memberships, and we're up to almost 380, and at this time of the year, it's much higher than normal. A new thing that we had this year on the registration form was donations, and programs like this were greatly assisted by donations to the education box on your registration form or the general fund. So we hope to continue to do these a couple times a year. Obviously, about a month and a half ago, we had the avalanches in this workshop, and now we're going to deal with summer skills. And the more we know, the better we climb, right?
Is that okay?
All right, without taking up too much more time, I'm going to introduce our first presenter. We will have a short, not actually a short, but a dinner break between the two sessions, and Larry will explain some of those details after Rod's presentation. But I want to introduce Rod Graham, a good friend of mine. I've been climbing with him quite a bit for the last few years. And I can attest on a normal one-day climb, his pack is heavier than anybody's because of all the first aid gear he carries, which is a good thing, except when I have to lift it up over a cliff wall. But he really is knowledgeable about first aid. He's currently an RN for the county and was an EMT for many years with various fire departments. And I'm sure we'll all learn a lot, and I'll turn it over to Rod now. Rod?
So I just want to start out with this. When I first started, I thought, you know, point A is right here and then go to point B up here. So I thought, you know, we're going to go up here just as quick as we can. Like this. Then we get up here and go over here, and then we go up one of these places here and get up at the top. And I thought that was what we were all going towards. Get up here as quickly and safely as possible. And then after being with GMS for a little bit, I found out once you get up here, then you want to get down just as quick as you can back to here so you can get to that beer before it warms up. So anyway, I'm hopefully having this made right. So we're going to just do a little housekeeping. If people didn't see where the restrooms downstairs, there is no restrooms on this level. They're downstairs. You go to the Bob Marshall exhibit, which would be in that main hallway where you came in from the front door. And you go back behind that exhibit, and the men's are kind of to the east part of the west, and the women's are to the east on the north side. We're going to take a rest break or a move around break about midway through. So, you know, I know what it's like to sit, and then a lot of people come from faraway places. So we'll try to get up and move around. And if I see somebody dozing off, maybe we can get up here and do some little hands-on stuff like that. So everybody can turn off their cell phones. I'd appreciate that. And then if we get a lot of information to cover, so if we kind of keep the visiting down so everybody can hear, that'd be great. And I'm just going to use this flip chart mostly just to keep me on track. If you would, I had 3 handouts that I kind of wanted to follow, and so the first one's the GMS Summer Skills Workshop. And this is not going to be a wilderness first aid program, but just kind of an overview. We've got some great resources. There's a Backcountry first aid and extended care book. We've got some copies up front, and I've got some websites that you guys can look on. Mostly what I'm doing today is giving you some resources and answering some questions and doing some hands-on to maybe help you have a little healthier experience if you do have a mishap when we're out. So, and then we'll go through an incident report form. And and it's a great template for prompting if you have a problem on the trail. And it's not a GMS mandated report that we'll follow, but it's just good information. I really love this form, and I'll kind of go through that a little bit with you guys. And then finally at the back, everybody gives me a hard time when they're out hiking with me because of the weight of my pack. And really, this is, you know, the stuff I carry, and it's not that much, but we're trying to keep our packs light. But also, I just want to, you know, I just want to go through. I put my list of things down, and we can add to that or discuss. You know, there's a lot of you that really don't have any reason or feel the need to take that kind of equipment with you. But I just feel that with some of the skills that I have, if we do have to, with the folks that I hike with, if we have to evacuate people, I'm going to try to do some advanced life support stuff before a helicopter gets in, or we have to pack somebody out to try to keep them alive if we have a critical incident. So I haul a little bit more than most people, but we'll kind of go over that at the end. I also wanted to go through, there was a great article by Jim Foster for president in the latest journal, and it's a report of all non-injury accidents. And I really agree with this because we want to learn from these incidents, and if we can do some education for people over things that has happened in the past, and just get some education so people are just a little bit more aware of some things. I think that's really appropriate. So anyway, this pretty much covers that area that I was kind of talking about. And let me read over that. This is going to be an in-depth group discussion. Getting in the group. How to improvise, adapt, and exercise a reasonable judgment in varied levels of medical training within our group in a remote and difficult environment that bears the essentials. This is a little bit just just keep me on point. So, first thing we're going to cover is Jim Foster's article, and I just want to touch on some highlights of that. Has everybody got their GMS or the journal this year? If anyone review it, kind of look at it. Anyway, it's on page 17, and I'm just going to read some excerpts from that real quickly here. A near miss is defined as an accident occurring in an outing, whether it's climb, hike, skiing, etc., where someone was called but no one was injured. Near miss accidents are often just as important as the accidents because there's always an opportunity to reflect on what led up to the near miss and lessons that were learned from them. So in studying these cases of near miss, it may help us prevent something similar from that happening again. If they're never reported by the climbing group, the whole group as a whole never had the benefit to learn from these mistakes and benefit from the lessons learned. So Jim has his email in here, and you'll find that on page 17. So he asked that in addition, this is pretty much for the coordinators that climb, they have always had to report accidents resulting from injury, but he wants us to consider reporting near misses to the president as soon as possible. And he has his email address at president@glaciermountaineering.com. And in your report, please give a brief synopsis of what happened, what you and the group feel caused the accident, what errors you believe were made, and what was done well. And so that's just a great deal of coverage with that. Anything that happens within our group. Okay, and then we'll go over the instant report form, and that would be that second sheet that you came across. There's a two-page, there's a front and back, there's instructions on the back. The big is just www.traditionalmountaineering.org. And so I really like this because it's a great prompt. It doesn't take any room. You can stuff it in your pack, maybe laminate it, or they kind of suggest that you do a multi-page printout so that you don't have to write a couple times. And why they talk about that is if you do have to do an extraction from the backcountry or evacuation, that if you have to send somebody out, because a lot of times we're past where cell phone ranges are, it'd be great to have a spot, but not everybody has a spot. And anyway, sometimes you might have to have a runner take that out to get to a place where we can report these accidents so we can get people moved from the backcountry. So that's kind of why they were talking about having a multi-page template to follow. So if you look at the front of this accident illness report form, you know, it just kind of takes you through what you do if you come across somebody. A lot of times it may not be a part of our group. It may be happening across somebody that's got into trouble in the backcountry. And so I just like the way that they handle this. They really give you just a basic, when you come on scene, just have some ideas how to follow. A lot of times it's hard for people if they have training in the way past to kind of sit down and just really think about what they need to do. And this is kind of a cookbook, kind of moves you through an incident that you can use on anything. It's just a great template. And I just want to really spend a little bit of time and just kind of go through this with you guys, okay? So safety is the big issue here. Try not to jump into some place that's going to put more people or you, if you come into an incident scene, that's going to put you at risk. So you can't rescue anybody unless you keep yourself safe. So the first thing they urge you to do is stop and look and think. Don't jump in and say, oh, I don't get in there and get my hands on this person, they're going to die. Because if you don't look around and you see the hazards that you might be walking underneath, you may do the next step, okay? So, and if it's, you know, most of the time we're going to be way out of range of having emergency medical services there within an hour. And then also always protect yourself, take universal precautions. There's a lot of things out there that can kill us when we're handling blood and fluids of other people. It's just something that we have to be concerned about this time of the, or this time of the world here. Okay. Also, while we're talking about this, I just want to show you this book. I really like this. Buck Tilton wrote this book. It's the 5th edition of a backcountry first aid and extended care. It weighs 3 ounces. It doesn't take up a whole lot of room. And again, it just covers a whole range of stuff. And I'll kind of go through. I'm not going to do a wilderness first aid class per se today, but I do want to kind of go through some issues in this book, and there'll be a few things that will break out that I'll spend more time on. And if you guys have questions about things, we'll cover that too, okay? But these are for sale for $5. Stephen was really nice enough to get these ordered and in for us here on short demand, so it worked out really well. So if you guys are interested in picking up one of those books, you can do that for as many as we have today, or else write down where you can locate those. Actually, if you go to Amazon, you can sometimes, this was a used one, I think I got for $4. There's different options. Okay, so what we want to do when we first kind of come onto the scene is kind of know where we're at, because nobody can find us unless we can direct them where we're at, okay? So the person that's going to be in charge, ultimately, somebody's going to have to step forward and make that decision who's going to kind of be in charge. We can't have a whole bunch of leaders and no followers. So and sometimes you don't have too many followers. There might be just one or two of you. So if you can have somebody that's going to be maybe just a scribe for you, that would be great. A lot of times that just takes a lot of stuff off your mind. You can have somebody writing down times. That's really important to the responders coming in to work with you. Because we need to, we aren't maybe all the time going to know when the incident happened, but if we have an idea when the clock starts as far as the rescue work goes, that's a great help too. Providers down the road from the ER, helicopter, whatever, okay? Just kind of have a brief description of the accident. What was the mechanism of injury, and how many patients you have, and what's their condition? Are they alert and oriented? Talk about what happened, when it happened, date, time, or date, day, and time, and where it happened, and to whom it happened. A list of witnesses if you have them, and then this just starts, it breaks down into basic patient care of what your primary survey was. And so we're going to, initially when we come across somebody and we determine that the scene is safe, we want to start down our checklist, and anybody that's had CPR classes even, or first aid classes, know that we use a lot of acronyms. So we'll start out with the ABCs, and they go into D and E. And so the airway starts off, airway, breathing, and circulation. And that's if we can keep those three things going, we're probably going to keep somebody alive quickly. Okay, so we're just kind of checking through that. Disability goes into the spine. We're going to be checking the spines before we move anybody. And we're looking at environment. And when we talk about environment, we're talking about heat or cold. We need to protect people from that. Okay, those are actually 5 things that are really going to affect the outcome of our patient. Then it goes into symptoms or descriptions of injury and illness. Then we talk about, let's see, I guess I went into that, patient symptoms and what happened. We'll go into vital signs, and we'll talk a little bit about that. We'll break that down a little bit later when I get into doing the actual going through the first aid book. Okay. So we're going to do just a good head to toe, and I'll kind of do a little demonstration on that in a little bit. We need to know what the level of consciousness is. Are they alert? Do they respond to verbal stimulus, a painful stimulus, or are they unresponsive where you can't wake them at all? And then it talks a little about their skin, their heart rate, and the respiratory rate. And we'll go ahead and go through the head-to-toe exam. We'll try to clear the spinal injury, and we'll go kind of a little bit through the spinal area. A lot of times we have to move people from where they're at. If we do things in the backcountry that we wouldn't have the option of doing when you're 5-10 minutes away from the emergency room. We know we've got a long time to get people there to extract this person, or we may have to try to extract them ourselves. So I'll talk to you guys a little bit about things that you wouldn't do on the street, and that'd be very frowned upon. I'm going to go in depth a little bit about processes that you can use to make some good judgments about moving people, okay? When normally you would do that when you had EMS within 5 or 10 minutes, okay? We'll cover that. So, we'll just go on, and it breaks down into, we can't diagnose, but we kind of have some suspect from the mechanism of injury, what we're dealing with, an action plan, what we're going to do, and we're going to get as much information and history from the individual or the patient that we can. And then it goes into the total number of patients, and we'll kind of triage and break down if we've got multiple patients, who's the worst injured, the person that is the most salvageable. If we've got multi-people that we aren't going to be able to remove, we're going to have to make some determinations about if there's things that we just cannot cover. You know, and that's just the way things are sometimes. We have to make a determination if we can protect everybody. Then it goes on into if we're going to stay put, if we're going to evacuate by trail, road, talks about shelter, and we always talk about air rescue, because we've got some really great resources in the valley. We've got the alert helicopter right in this area. St. Pat's has an excellent air medical service down there. And we have a new air rescue up here. It's called Glacier Area Rescue, or Glacier Area Rescue and Evacuation. It's anyway here, rescue. So, new helicopter just started, and it's a great deal. Top of the line technology in our area. And it goes on a little bit more weather on scene, and this is good for, you know, if somebody's going to have to run out with this information and kind of let the responders that are coming in to help you out know what the conditions are on the scene. Okay, and I'm kind of going to stop at that juncture, and we'll just carry on to, I don't see anything else here that I really want to cover. They do on the backside talk about hands-only CPR, and this came about April 23rd, 2010. In this day and age, a lot of people are really concerned about making skin-to-skin contact when we're trying to rescue someone, and with good cause. So they've actually done some studies, and I was a little bit hesitant to jump in and do this until I did some more research, but our big deal is if we have a witnessed cardiac event where somebody goes down, the quicker that we can turn that episode around, the better off we're going to be. And the main thing that we want to do is keep that oxygen flow through the bloodstream to the brain and the vital organs. We want to do that right away. So anyway, I still like to ventilate patients. There's things that I carry along with me, a pocket mask to be able to achieve those things, and then we have to make some determinations too whether we're even going to start. Sometimes if somebody's walking and talking and the next minute they're down on the ground, chances are that they had a life in an event. It's always good to assess as much as you can. Not ever going to tell somebody not to start CPR. But chances are, if somebody's walking and talking and not having an issue, and the next minute they're on the ground and they didn't wake up when they hit the ground, they probably are not going to wake up. And yes, you have to open an airway, check and make sure. But you have to have it in the back of your mind that if you're 20 miles into the backcountry, it's not realistic to try to do CPR on somebody coming out of the backcountry. You're probably hours away from a rescue for somebody to be there, and it's hard to know if there's going to be enough resources even to continue. A lot of CPR, and unless you have a defibrillator close by where you can reset that heart, chances are you're not going to have a good outcome. And it might be just a great way to lead. And I'll I'll tell you all, if that happens to me, that's the place I'm gonna go. Because I'm with my friends and I'm doing what I want to do, and there's nobody that gets out of here alive, so that, just stuff to think about, okay? So, I'm gonna slip through here. I've got, one of those handouts is the gear list that I carry, and this is not inclusive, and it's not something that everybody needs to carry, but, yes.
No, most of us did not get that handout.
Oh, I'm sorry.
Some extra copies of those? I have
In the
one.
back,
I
on
only
the
got 5
three-quarters
of those.
copy, the back one.
Quite a while ago.
And hopefully we didn't run out.
I'm just wondering.
You guys might have to share. Here.
You got all that stuff.
You have to share, I don't know if it's here.
Sorry to interrupt.
That's all right, that's good. And if you guys have any questions on anything as we go, or any discussion, please feel free to bring it up. And we'll get out and do some stuff. Everybody doing okay as far as sitting down? If everybody hear me, I'm just gonna take a little time since we kind of broke the line of thought here. So anyway, if you see something on this list that we can maybe make some changes on, or I just wanted to kind of have something in your hands so that you can kind of take a look and see the differences in what some of the stuff that I take along. And again, I just want to kind of just show you that there isn't that much more. Maybe most people take maybe about this much, I'm not sure, of gear, and always maybe just take a little bit more, just because. Okay, we covered this. This is reportable non-injury accidents, Article 17, and we went through the actual report. And so we'll start in the Buck Tilton's Backcountry First Aid and Extensive. Let's get it clear. So in there, he's got it's a great checklist. He calls it the action checklist. He asks to remain calm, take charge before stepping in, size up the scene and make sure that the scene is safe. And then you perform an initial assessment. And I kind of went over that a little bit with the incident report. That's the time that you would be checking the airway, checking their consciousness level, checking their pulse rate, and breathing. And that's the time that you correct life-threatening events, such as if they weren't breathing, then you hopefully breathe for them. Get them started breathing, clear their airway, if need be. Check that pulse in the normal setting, such as where we were today. We start CPR. Okay, if their heart wasn't beating, we start doing that quick, deep, fresh, and push on the chest to do the take away the heart's function. Okay, after we go to get through that area, then we go ahead and perform a focused exam in history. And this has a lot to do with their level of consciousness. If they can tell you what happened to them, or it's obvious from the mechanism of injury, you can make some pretty good determinations about what you're going to have to do to correct or eliminate life-threatening problems with that. And then we want to make a plan. What are we going to do? Are we going to stay or go? And are we going to do it fast or slow? And then we talked about the accident illness report form. That's not a form that we have to use for GMS, but that I really like that form. So if you can fill out some paperwork similar to that, if you don't have this report form, that'd be great. And then be ready to give a verbal report, whether that be by just by cell phone, if you're able to contact EMS or 911, or whether you send that out along with somebody else. They need to have that information. And act in the best interest of most people, okay? There's going to be some people maybe that we're never going to be able to save, but we want to do the best job that we can with the people that we are able to do so.
So can I interrupt just a second?
Absolutely.
As far as cell phones, in some of our literature online, the coordinators are advised to always carry a cell phone. Even though maybe 50% of the time it doesn't work, you might be able to get service that you didn't think was there. And I just wanted to bring that up, that literally every coordinator should carry those on the trip.
At least one in the group. And it'd be great if you had a spot. It'd be great. And everybody knows what a spot is, right? Direct communication with a satellite. So, okay, so we're going to start with a patient exam, and we'll do a head to toe. And the first thing we want to look at is the whole patient. Do we see any wounds? Do you see any swelling of tissues or deformities? Okay, and this is pretty much set up for a trauma patient. And then we're going to ask them, and part of this is part of our level of consciousness. We're going to ask, where is the pain, and does it hurt when I touch? And I'm going to demonstrate a hands-on, and then we'll just do, you feel, you gently but firmly go through each of the, from head to toe, okay? So I'll go ahead and do that right now. And if you guys want to get up, and come up, I'm just going to grab probably Dawn here, and we'll just go through a quick head to toe assessment. I'll stay on one side, so if you guys want to, if you guys want to stand up and come up to the front.
Stand.
Okay.
Okay. I think you must have drank too much.
I think it's interesting.
Okay. So what I'd like to do first off is we're going to determine his level of consciousness. So I'm going to come up and
I've been trying to do that with him for years.
Can you hear me? Are you all right? And this is the same thing as we do with CPR, okay?
Yes, I can hear you.
Okay, so where do you hurt at?
The lower leg on the left side.
Okay. So do you know what your name is and where you're at?
Sometimes.
Was no joke the other day? You're doing pretty well with it.
Sorry, Doc.
Okay.
Yeah, I'm here at a wonderful first aid class.
Okay, great. So until I find out if he's got any cervical injuries, I'm going to kind of stabilize his head here, okay? I don't have any true mechanism of injury at this point. Looks like maybe he just is on the ground. So if he was down below a cliff, I would be pretty suspect of maybe a head spine injury, okay? So at this point, I'm kind of talking to him. I've got a pretty good rapport with him. He's answering me back pretty appropriately. And so I'm thinking he's pretty well with it, okay? I also determined that his airway is open. He's talking to me. He's breathing well. And I don't see any blood. I don't see any swelling. And I don't see any angulation of any extremities or anything else. So at this point, I'm going to go ahead and just do a quick assessment. I'm going to feel around. Do you feel pain anywhere?
No.
Okay, anywhere I'm touching, is there any pain? Okay, so I'm going to go right down the spine. I'm going to kind of go up from the base of the back and try not to move, but I'm going to try to hit that spine all the way down. Did you have any pain with that?
No.
Push on the shoulders, pull up, come down the chest. Any pain in your chest? Okay, any in your abdomen? Okay, okay, push on the hips, nothing. We've got extremities up and low, and I'm going to just kind of check both to make sure they're the same. I'm going to ask them to grip my hands when you get down to the bottom. And any pain with any of that movement?
No.
Okay, so we check the pelvis, start up here, and down the legs.
Ow.
Okay, so you got pain right there.
Yeah.
Okay, so we got left leg pain. Any pain on here?
No.
Okay, so I want you to press with your toes against my hands. Okay, and then pull up. So this is a great thing. He's got a little leg pain, but you know what I just found out? He doesn't have a fracture problem because he had really good, strong flexation, and so that's a really great thing. And the other thing that I just found out when I squeezed his hands, he's got pretty good feeling. He followed commands, so he probably doesn't have any spinal injuries. So from what I see here, if I was in the backcountry, I wouldn't feel too bad about moving this fellow. So, anybody have any different ideas?
Would you put on, I mean, if you didn't see any blood, would you put on any protective gloves or not?
I do. I carry them. I think everybody should. It's not saying that we aren't going to turn them over and find this big jagged thing. When I reached up underneath, I could run right into blood. And as long as you don't have any broken skin, you're probably going to be just fine. But anyway, that's kind of a basic head to toe that can be done within about a minute or less. And of course, we had some issues here. So he was claiming pain. So what I would do next is I would expose that area and find out why he had pain. And we go on from there with our secondary. So, kind of looking at this level of consciousness, heart rate, respiratory rate, skin color and temperature, and moisture. And we'd want somebody to be writing all this stuff down, okay? A lot of things to write down. So whoever's kind of documenting this will have a full-time job, especially all around, okay? So, I'm going to break these down a little bit. Do you guys want to take a quick break? Does anybody need to take a bathroom break, or is everybody doing fine? Okay? If everybody's doing fine, I'm going to continue on. So, airway obstruction, there's a lot of classes that in the community that can get you certified for CPR and obstructed airway, and I advise everybody to keep that information handy and check into that. Things do change along the way. It talks about it in this book pretty good, gives you some pretty good pointers, and I just recommend for you and your loved ones that that's a very important thing to do. Okay? So, spinal injuries, I talked a little bit about what I was doing in the this survey that I was doing as far as spinal injuries. There's many different spinal injuries. There's deceleration injuries that occur in car wrecks or when people fall off the cliffs and stop really quick. There's crushing injuries where people, say if somebody falls off a cliff and they collapse vertebrae, all your electrical system that innervates your nerves in your organs, in your brain, goes through the back, and if you have spinal or back injuries, that's going to affect your lifestyle drastically the rest of your life if you go through it. Head injuries are very important. Your brain is your computer, runs all your body processes, and there's things that we can look at to kind of determine that, okay? I talked a little bit about on the spinal injuries, if you check at the end of the feet and the hands and arms, if they've got good strong movement that's equal, you're pretty sure that you've got a good electrical system going, that your nerves are going to innervate your muscles all the way from your head to your toes.
At that point, Rod, would you be willing to let the person sit up if they could?
Well, what I'm going to do is I'm going to probably get a little bit more information before I would get them up. And it depends. Let me change course here just a little bit. if you can get this person out and the mechanism of injury is there that you suspect there might be a spinal injury, and this person is not in danger of either, of succumbing to some other problem, say environmental. Let me just talk about this. If you need to get somebody out, this is things that's happened to me, where you're crossing a snowfield here, and you're coming across here, and everybody's doing good, and then all of a sudden, you're kicking holes in across the snow, and your partner behind you decides to tip over and go downhill, and then say there's a snow bridge here, and you break through and wind up down in the rock, stream down below the level. This is like a freezer inside of there, so you're going to have to make some determinations. Or is the guy going to succumb to a spinal injury? If you can kind of do some of the things that I'm talking about, you may not have the ability to, you definitely don't have a backboard to get him out of that area, but you probably aren't going to be able to evacuate him below. You may have to pull that guy or help him, assist you getting him out. So you have to make some determinations if this guy is going to be able to help you out. You're not going to be able to leave him in that deep freeze that he just fell into. He could be laying in water or rock, or you just have to make some determinations. So I guess the thing is look at the level of consciousness. If they can tell you if there's any pain or any loss of consciousness, then I would be very careful about moving without enough help. But you also have to make the determination, are they going to be at risk for staying where they are? Is the chances of a possible spinal injury going to be detrimental to their health if they continue staying where they're at? So you might have to take that into account. And to do that, I would certainly check a pupil reaction and breathing rate, and if they remain conscious, if they start drifting in and out, if they start complaining of a severe headache, or say vomiting and getting sick to their stomach, I'd certainly be very cautious, but sometimes we're going to have to do the best that you can with what you have. And if you have to make a neck collar out of a parka to stabilize your neck and try to get them up and out of that area, you have to kind of rely on what you have with you. And it also really depends on how far away help will be for you too. So any questions or discussion on that?
When you're talking about a compression, injury to the backbone, or strict deceleration, or anything like that, what does it feel like when you're going down the spine?
Okay, you may or may not find some angulation. You might find a deviation to that spine. You can feel in your back, and you can practice on people to see what that normally feels like. If you come across something where somebody has feeling up above, and all of a sudden you come across an area where they say, I can't feel anything, you want to be very suspect at that point, because you probably have some impingement on those nerves coming. So, it could be an upset of the vertebrae, or it could be a crushing injury. It's just kind of hard to tell. You just have to kind of go on with the mechanism of injury, what happened with the person, and the way that they're presenting to you, how you found them. Are they on their chest, or are they on their back, or on their side, or upside down? It's very subjective to where they're at. Does that answer your question?
And is there times that they can have the injury and you're not going to feel it, and they don't?
Absolutely.
Okay.
That's what we have to worry about the worst. And that, you see that in car wrecks all the time. You find people up and around, walking around, and they're running on their adrenaline. They don't feel pain, or they have some substance in their body that's helping them not feel that. And so we have to be very, that's why, you know, in this kind of area that, especially with EMS, that you would want to go ahead and put them on a backward right away. The mechanism of injury is going to make them suspect for a spine injury. That's the first thing that we want to take care of. Okay. Questions on that? Okay, head injuries. We've got external head injuries and internal head injuries, and both serious, the blood or the brain and the surface tissue of the face and the head and the skull is very well supplied with blood. Anybody that's ever seen a head injury knows how much they bleed. They bleed a lot. The biggest problem with the internal skull injury is there's limited places for that blood to go, and the swelling is going to take place and cause some issues. You're going to see these injuries have a drastic effect with the level of consciousness for the person. You may somebody may be talking to you one minute, and the next minute they're losing their conscious level, not able to respond to you, and that is certainly a very serious injury, and that's something that you want to get out of the backcountry as quickly as you could. External injuries, you want to stop the bleeding as much as you can, as quickly as you can. You want to try to keep that fluid contained. Ways to do that are the pressure points, somewhere through the head, compression dressings, and just bandaging. A lot of times the platelets will really help with that clotting. But anyway, try to contain that bleeding as you can. Okay, going into any questions on any of this stuff? Okay. Going into shock.
Concussion. And,
Okay.
And just, confusion, the dilation of the eyes and all that kind of stuff.
So the question you're asking is if, as far as a concussion, there's many different levels of concussions, and a lot of times we can't really determine exactly what's going on with that. I'm looking back at my notes here, just on kind of, this is the thing that I was trying to, chain that I was trying to follow is protection is a priority, and detection is, as far as labeling something is kind of secondary. That's something that we can deal with at a later date. Just be aware of it, note that it's going to make a change in how we're going to move that patient probably, and the quickness that we're going to try to get that patient out of the backcountry and make that extraction. So, okay. I want to back up here just a second. I'm sorry I got out of sync here. As far as the cervical spine, anytime that there's for every trauma patient that has a cervical spine injury, or they have a cervical spine injury until proven otherwise. And you can't really prove that without x-rays, and that's impossible to do in the field. So the level of consciousness is our big indicator on how we would treat that patient. If they have a poor level of consciousness, that could be masking cervical injuries. Even if you do that head-to-toe survey, you may miss something because they're not able to help you make that determination. Another thing that we have to watch for is intoxication. That masks a lot of things in the field. And it's not saying that we go out and get high before we go climbing, but that happens a lot. And so we certainly could see that in the field. So, just because we don't do that doesn't mean that doesn't happen. So that's something that we have to think about, because it does happen. any major injury above the shoulders is a suspect that you will have a cervical spine injury. Any major pelvic fractures or long bone fractures, or any major visceral cavity injuries, say to the abdomen, you want to be very careful about that. So I kind of went into doing some clearance for just rescue, backcountry rescue. But the only time that personally I would ever move somebody, and unless they were in danger of dying from something else, this is the criteria that I would use before I moved somebody without total cervical traction on a back foot, okay? They need to be alert to person, place, time, and event. That means they need to know everything about themselves, the day, and what happened to them. So they're awake, alert, sober. There's no pain on the spine or any distracting pain, and that means that whether they have a stubbed toe, broken finger, or a major head injury, that cannot distract them from when you're palpating down that spine if they do have pain present, because they might be focused on this other pain where the spinal pain is going to cause them some deficit if you do move them. And they cannot have a history of transient neurological defect. Say they've even passed out for 5 minutes or 2 minutes. I'm going to be very cautious about moving them. And if you find any pain on full range of motion of the extremities, that's going to make you very suspect. If they cannot move their arms on their own power at 2 different, say, extension and flexion, and out to the side and rotate, you're going to be pretty suspect of some problem with the motor neurons and muscles. So I just wanted to saw that in the notes. Wanted to cover that. Okay. Shock is irreversible body changes that will probably kill a person. And that can be from many different stimuli that may cause that, from cold to exertion to dehydration to heat to cold injuries. We want to reverse that as quickly as we discover that. And, just going to leave it at that. Any questions on shock at all?
How do you reverse it?
Okay.
Make them drain?
Well, you need to go back through your survey because you're going to use this same survey when you check any patient. So when you come across something, a trigger point that's caused, you have to be, you need to reverse that as quickly as you can. So if it was a heat injury, get them in the shade, get them in water, they need electrolytes, change that, and let them rest and cool. So that's just for heat, and I'll kind of go through some heat emergency and hyperthermia and stuff like that. But anyway, you want to reverse the process. Whatever started that cycle of going down, you need to get that changed as quickly as you can. Sometimes you can't. Yes, ma'am.
Is there any kind of electrolyte that is less likely to upset someone's stomach or?
Okay, there's a lot of
easier to
products.
take?
There's a lot of products in the field, and I'm a staunch supporter of Hammer products. They make electrolyte solution you can put in water. It's very easy to take. It's very effective, and I try to kind of show people that I hike with how important it is to remain in balance. The body works on a very limited, narrow range of electrolytes and minerals, and of course our body is 70% water. So we need to be hydrated, but we have to be very cautious when we're working in a hot environment that we don't overhydrate without the proper electrolyte replacement. So I'm a very firm believer in that. There's information on that back table about hammer products. You guys are welcome to either copy the information down or take those flyers back there. But I found that the hammer products to be very good. Anything else?
Just, I've never used electrolytes before except for riding a bike up Big Mountain. And last year, climbing Cannon on a hot day, I started feeling kind of dizzy on and off. And I think that was the problem, drinking a lot and not taking
Absolutely.
anything else, not
So
replacing.
it's very important that in our hiking groups or climbing groups that we watch each other because we don't recognize it in ourselves sometimes, okay? So just be cognizant of how everybody's operating and if they're performing the way they need to be. If you find somebody that's lagging, getting cramps, feeling sick, headaches, dizziness, kind of start thinking, you know, how is this environment affecting me and how might it be affecting somebody else and what can we do to keep people protected. So it's just great. Yes.
Back when I did my CPR training, they taught us to put someone's legs up to avoid shock. Is that something that you would still do or want to avoid if you were worried about spinal injuries?
Well, I'll tell you, probably unless somebody fell down from it due to it, but I really like for everybody to, my whole thing is if we can avoid getting to that spot, have to make some really good determinations on where that person is. If the likelihood of somebody falling from a standing, I'm not going to say it's never going to happen, but you probably are not unless you fall off a cliff or off a bad area of the trail. If you just fall to the ground, you're probably not going to have a spinal injury, and that's a pretty dangerous thing to say. The chances are of having that, I think if they are in shock and it's from dehydration and they fall to the ground, that you want to treat the dehydration. It doesn't mean that you're going to crank them around. You can gently bring their knees up on the ground while somebody's stabilizing their head and back and get those legs up. You know, it doesn't mean that you have to be moving them around to maybe compromise that spine. So use your best judgment. That's the deal with these injuries is you just really can't have a really good pat answer for everything that's happening. So if you can keep somebody in line and just keep some traction on that neck until you have some better idea what's causing the issue and try to reverse that, that's probably your safest bet. All right. So chest injuries can be very bloody and messy and life-threatening. And again, you want to stop that bleeding process as quickly as you can. Keep that spine protected because you're going to suspect a spinal injury if you've got a large chest injury. It can happen from anything from rocks falling down on people or people falling. Just be aware that all your vital organs are contained within that thoracic cavity and your abdominal area. So you have to be watching for things that might happen to those organs underneath. Okay? A lot of bleeding with those. Abdominal injuries are pretty gross injuries. Sometimes they're bloody and sometimes they're not. Sometimes you just have a restoration where you have bowel contents out on the ground. And so those things you want to try to contain as much as you can. Don't try to push them back into the abdominal cavity, but keep them protected with moist, sterile dressing if you have them, not keep them moist. Okay? So muscular skeletal injuries, I think that's probably what we see the most out hiking. Possible broken bones. And so we want to splint above and below the side of the break. You can have several different types. A simple fracture is a long bone that is just broken or cracked, and the bone is not protruded through the skin. That is fairly easy to, you have to watch for shock, keep them well hydrated, keep them warm unless it's a hot day, and stabilize that fracture site. And that's probably something that's going to end your event for the day. You want to walk somebody out and get them back out. So, and that's the deal on all of these. It's very important for us to get to the peak. It's very important for us.
Have we split into 2 groups?
That likely would happen.
Just wait here.
So with wound management, the first thing that we need to do is stop the flow of blood. We want to try to keep that area as clean and protected as we can. Let's try to take at least a 4x4 or something along to put over an injury site, and some tape maybe to hold that in place. And we're going to have to use our whatever we have with us. Sometimes we're going to have more injuries to cover than what anybody could ever pack or anticipate ever using. So if we have to use shirts or whatever as bandages, we need to be thinking about that stuff. Okay. Try to keep it clean. That's the main thing with any open wounds. And if it's a wound that you cannot debride and clean, that's something that always can be done later. The main thing is we need to keep it as clean as we can, and we can deal with infections and whatnot later in a pure facility after they're evacuated out of the area. Okay, a big deal that we have here in this area is hypothermia, and anybody can get into that pretty quickly. There's a great article in the journal about river crossings. Pay attention to those things. We can just get it just by being outdoors, getting cold, not having the proper layers of clothing, and being able to layer for the area that we're in. So again, if you're walking with somebody and they're starting to trip and stumble, or if you see them start shivering and shaking, those are things that you want to reverse as quickly as you can. Okay, heat illnesses, we talked a little bit about that, with electrolyte replacement and proper hydration. There's always, seems like, people are running out of water on a hot August day. And always try to carry a filter along. Fortunately, we get into August and September, a lot of our water sources are drying up or non-existent. So good pre-planning, always try to take more water than what you're going to need or what you anticipate. If you have a chance to fill up along the way, it's always good to filter and always have plenty of water on board. Hyponatremia, that's, again, we were talking about electrolyte replacement. And that was a very great question, and just be watching for that, okay?
Is that the scientific name
For electrolyte loss.
You might wanna,
What did I do some?
you hypernatremia? You know,
Hypernatremia,
that's high sodium.
yeah.
We don't run into that as much.
Okay, so, and that will happen if you don't have enough water on board.
Oh, yeah. Oh, yeah.
Hydrated, okay? So, so those go hand in hand, okay? Because we're working on that narrow range, and I should have put hyponatremia because that's what we're going to be more concerned about as far as electrolyte replacement. But we can also get into hypernatremia if we don't have the water source to keep our body hydrated properly. Okay, good. Okay, allergic reactions. Folks that know that they're allergic to bees should always have you come along with them, for sure. And the thing that we don't know is when we are going to develop an allergy, because we all have that. That could happen to any one of us at any time. So, and I don't carry epinephrine to administrate to people, but again, the main thing of that is you need to keep the airway clear, because they could have swelling and compromised airway, and that's a good reason to get somebody out of the backcountry. If they start swelling up from bee sting and it's affecting their breathing, it's appropriate to get them evacuated out. It's certainly something that I would be calling alert to.
Now, Ron, you did have Benadryl on your list.
I do.
That does help with that, right?
I do carry Benadryl, but if you're having a severe reaction, it may slow it down a little bit, but it's not really gonna affect that, okay? So, anyway. Okay, dehydration, I think we beat that to death. Okay. And, I'm just gonna go through a little bit more. We talked about intake. The other thing is when we're in the backcountry, and it may not hit us the first day, but probably the second day, we get a little giardia. We're going to have some diarrhea. That is one way to lose a lot of fluid. So just be aware of that. Try to just, I guess the best way that I can tell you is to hydrate. And you don't have to drink great quantities of water at once, but if you drink a sip every 5 minutes, that's going to hydrate you well. One of the things that you want to watch is if you're getting real condensed urination, it's time that you need to recognize yourself that you need to up your hydration. Okay? Okay, some environmental concerns. Sunburn, we can protect ourselves from that. A lot of times we don't want to take time to apply sunscreen lotion because we're ready to get up that hill. We want to get up to the top and get onto that pier as quickly as we can. But just try to do a good job. And we can do that with sunglasses and proper headwear. Use the sunscreen. Doesn't weigh up too much. It's good to pack. Snow blindness. I've had that a couple times myself, and it hurts. It can really change your destination from the peak to having somebody lead you out. So it's very painful, not a good experience. So even if you leave early in the morning and feel like you're going to have some cloud cover, it's always good to have that protection. Take some glasses or goggles along. Altitude illness, we don't see it here too much, but it sure could happen. We have friends and relatives that come in from out of town that's near sea level, or not used to our environment, or you're going to take them up on a 10,000-foot peak. You might run into that. Usually it's above 10,000 feet that we see that start to really affect people. It's just something that I just kind of wanted to touch on just quickly. Okay, blisters are a big issue. We see that all the time. So I used to carry moleskin, and I don't really carry it too much anymore. And I'm not saying that you shouldn't carry it, but I found some really good things that really change the whole deal here. They have a thing called second skin, and you can get them in these little canisters, or just a little plastic break-off tube. And when you first feel a hot spot coming on, if you can take some time and take that boot off and just kind of stabilize that skin with a second skin, it's like super glue, but it's not detrimental to our tissues. And just kind of stabilize that. That kind of makes it's almost like a cast-type covering over that hot spot. And if you need to change socks so you don't have wet socks rubbing on a part of the boot, that's great. A lot of times if you double layer with a real thin sock with a nice heavy layer over the top, that'll hopefully keep those boots down. And then try to make sure that the boot or footwear that you use is broke in before you take those ones. Hard to do sometimes. Water disinfection is a big issue, I think. And it depends on the time of year. It's always safe to carry your own water. If you run out of water, you should have a filtration system that you can protect yourself from giardia. One bout of giardia for anybody is enough to cure. Enough said on that.
Question,
Yes.
or actually an idea, back to blisters. A front turns me on to a great blister preventing device. If you know that you get blisters on your heels fairly easily, if you put duct tape on your heels
I agree.
before putting on your socks and boots, before you start out on a hike, you aren't going to get blisters.
That's a good deal. I've used duct tape with good results in the past.
Just don't rip it off at the end of the day
Yeah.
until it's well set.
Especially if you do it after you start getting a hot spot. You should have probably something to protect that area before you do that. The only thing that I found with duct tape is it does have a tendency to roll and possibly pull adhesive on your socks or whatever. And it may cause a problem on the other side of your foot. But I really do like that second skin because it's just an area that's contained that's a very hard, it covers and protects that skin. And just so that foot later will come right off. So it's a great thing to take along. Okay, the other thing we all know about is bear spray. And we can use that in the winter as well as in the summer when the bears are out. Getting more predators out there all the time. There's cats and wolves and things. Yes, sir.
A lot of people have managed to discharge bear spray on themselves. So what do you recommend as the best remedy to alleviate the discomfort?
Okay, so first off, you want to make sure that the wind's not in your face, you're not pointing this upwind. And then make sure that you're shooting it the right way. And don't shoot when the bear is 40 feet away. Wait. The best thing to, there isn't going to, I don't really have a good solution for you. You want to keep the eyes flushed out. That's going to be the biggest pain. And you could have some airway involved with that bear spray. It's pepper, and it's going to hurt. If you inhale it, I don't have any good, it's just going to be time. It's going to be a time.
Water makes it worse on your skin.
Well, it is, but you're going to have to flush those eyes.
Yeah.
You've got to get
Take some sunscreen or something. Like if you get home and you want to use detergent, soap, or some kind of liquid, water will just like.
It hurts.
Or salt, go on a dishwasher.
Yep.
My main concern
You
is
have sunscreen at the, if it's just on your arm.
if it's in your eyes, try to get it flushed out. Use copious amounts of water. I think we're about out of time here.
We got a little extra.
Okay,
We
we're all right.
were, I'd say 15
Okay.
minutes because we started 15 late.
Okay, so I'm just going to go over just that list, and of course, I gave all my notes. I'm just going to grab it with this here. So, and this is just me, I just wanted to put out a little list to, that I think is really important, and you guys can adjust this as you see fit. And, you know, a lot of the stuff that I'm talking about, this whole group has got so much experience that this is crazy even to talk about, that if there's 2 or 3 people in the room, that it helps. That's why I went a little bit deeper than what I maybe should have, because there's so much experience in this room that I don't want to be talking to anybody. But I just didn't want to miss anything either. So proper clothing for conditions is very, very important. And always extra stocks and possibly a bandana. You need that wicking long sleeve layer, base layer, and then you need that insulating layer, say a fleece jacket. You always need rain, wind gear, and the jacket should have a hood, and that includes pants. You need more cotton gloves, water, and appropriate amount of water, and for purification equipment. Always need enough food, bring extra in case. You don't want to run out in the middle of the night if you're going to spend an extra day in the woods that you didn't anticipate. Okay, I talked about bear spray, cell phone or spot device, GPS, map of the area, compass, and signal gear. Always bring a helmet, headlamp, and light. Leather gloves, I think, are really important. It depends on if you're just going to be doing trail work or if you're going to be scrambling. You want to make sure that your hands are protected. Let's go. I like taking gaiters and trekking poles. I think a foil space blanket is imperative if you're going to spend the night out. It might save your life. They don't weigh up. They come just packaged really small. Trying to find one. You guys all know what they look like. That little thing might save your life. Okay.
Something that just occurred to me, that I don't normally carry is one of those little hand warmer things that you shake and can use when you're skiing. Because that in combination with a space blanket can make you pretty trusty.
Another thing that I would say that if you do get cold is use calisthenics, companion wrap-up and something like that. I hate taking hand warmers because they're bulky and they sometimes when you need them, they aren't able to work.
I've used them on a sore muscle too, and they come in handy.
They are great when they work.
Duct tape it on. And,
Yeah. They're a wonderful thing if you've got the room, but I was trying to keep this list down because we can overpack and incur injuries by taking too much stuff along with us. So. Okay, then I just go into energy gel. I'm a big, again, supporter of hammer gel and electrolyte tabs. So it's good to have a power bar or two along, and I like to take duct tape along. I don't like to take it on a roll, however, it takes up too much room. So I like to take 2 or 3 feet and roll it back on itself just to cure it. You can pull that apart and use it as you would coming off the roll.
It wraps around your trekking.
Exactly.
Yeah,
Yeah.
that's a good spot to cure it.
Why duct tape?
White duct tape.
Can you use it?
I don't know. I just like carry like transport or something.
I do that in my first aid kit. But this is for if you're going to try to splint somebody up sometime.
That's
or-
what the Ace and the Sam splint's for.
Yeah, but I'm not going to be carrying
Oh,
all
okay,
those.
okay, never mind.
It's up to you. You can add to it.
If you had to, like you broke a shoelace or something, you could duct tape your boot together. There's a lot of uses.
Yeah.
Just watch the regular show wearing all the time.
Could duct tape a friend to a tree if you got there.
So Ron, I do have a question. Can you skip the line? I know what I would use a large trash bag for, but I'm wondering what you would use.
I'm going to use that for numerous things. I'm going to use it for protection.
Okay.
Number one, okay, if I need to make a shelter for somebody, it doesn't take up much room, and it, you know, between a space blanket and a trash bag, you can cut that and fit it around somebody, keep them pretty well sealed from the elements.
Okay,
So that's my big thing, taking a trash bag.
okay.
Okay. Sorry I missed a line there. Okay, sunscreen, sunglasses, hat for sunblock, we talked about that. Possibly insect repellent, that's kind of a maybe. Hand sanitizer, I really like that, I think that's appropriate. And TP, matches, and a lighter, I like both of those in case we need to start a fire. Something's not gonna work somewhere along the line. I use Vaseline in a film canister and for cotton balls with Vaseline rubbed into them. For fire starter, there's also different fire starters. Works really good. Always take extra batteries along for your camera or your GPS, okay? I like a small rope or a cord, 10 to 15 feet in length. That always helps. Maybe it's not something that I put somebody's life on, but if somebody gets in a tight spot and they just need a little support getting past a spot where they're stuck, it might really bail you out. It's also handy if you get to a spot where you can't pack a pack up, where you can, one person can climb up through an area and drop it down and pull the packs up, and then you can be on your way. Safety pins are great, little devices. It seems like there's always a reason to have them around. A whistle's a good idea. And then at the end, I just put common sense plus range plus training and planning equals good outcomes and successful events. On the first aid supplies, acetaminophen and ibuprofen tablets I think are pretty appropriate. I add aspirin tablets because if you have somebody that's having angina, pain, or cardiac issues, if you can give them an aspirin early on, that may save their life. If they have a clot issue, blockage somewhere along the way, I'd certainly start an aspirin right away. Take a roll of surgical tape. I take electrical tape, and again, that's kind of like duct tape. I found that it's stretchy. It's once you apply it, it pretty well stays. I don't like to put it skin to skin. I like to have something underneath skin, or at least a layer of protection, because the adhesive sometimes causes a rash, and it's hard to get off. Okay, talk about Benadryl tabs. Bismuth is kind of like Pepto-Bismol or antacid tabs. Antidiarrheal tabs are pretty important. It's like little Oracel or Oracel gel packets that are pretty small and they don't take up a bunch of room, but they can sure take a lot of pain away if somebody loses a filling or falls down and breaks a tooth.
So that's a dental painkiller?
Yeah, it's just a topical benzene cream that you can just apply.
Sugarless gum comes in handy too.
Sure, certainly a plug of something that comes, but I just carry some of these things.
Gum, try sugarless gum. You can, the air, once the air is covered, you cover up the opening.
The other thing that I think is very important is 4x4 gauze pads, and it'd be nice if you can have those sterile. Liquid bandage is a must, I think. Antibiotic packets, maybe not. The thing is when you're taking liquids along, you always want to keep them contained within a Ziploc bag. You don't want something to break or contaminate everything else that you have in your pack. Okay. Adhesive kelpo pads, if you've got some skin that you need protection from, that's kind of a nice thing to take. They don't take much room. And I talked about a Zirform petroleum dressing pad. And this is what I carry along if somebody has a chest wound. There's a couple things that I'll do in the field that you guys won't do it. If somebody has a second chest wound, I want to make sure that they don't collapse along. And so I'm going to make an area for that air to escape. needling a chest or just containing a second chest wound. And that's, I don't know if you guys seen them before, but they come in a foil packet, and it's a Vaseline on the inside. You don't, I never throw away the inner bandage. I've never used the inner bandage before, but I use the foil packet. It's a sterile dressing to work with when you're working with a second chest wound. Plus, it's got Vaseline on the inside that's going to cause a seal. It's going to let that air escape, but when they breathe in, it's going to cause a seal. And you want to tape on 3 sides of that, so one side can be butterfly. So that's why I carry that. Q-tips, if you get something in an eye, it's almost impossible to get it out in the corner of a hand or something like that. And I just had enough eye injuries and enough foreign bodies in an eye that that's good to have. Always like butterfly closures or steri strips, large Band-Aids or regular Band-Aids, a combination of abdominal pad. There's all kinds of things people use. And then you need to, maybe if you have a medical history, I like to have people carry that in their first aid pack. If they can just have a brief written medical history with a list of current medications and allergies, if somebody comes across you on the trail and doesn't know that maybe you have a heart condition or some diabetes or anything, it'd be good to have this information down. It sure will help the first responders and the tertiary care providers further down the road. Trauma shears, I think, are very important. I carry a pair, you carry a knife or whatever you need. I take a stethoscope. I want to be listening to airway issues, just because of what I feel like when you, of course, this won't apply to everybody. And, you know, sterile syringes and all of that stuff you guys are going to use, but I do. And I just left them on my list because I just want to put it out there for you guys, okay? Nitrile gloves, I think they're very good.
What's nitrile?
Okay, they're just regular.
In particular.
Okay, these are nitrile gloves. Okay, just something to protect yourself. Okay.
They're not latex, so they're less
They're not
likely to
latex.
cause
Oh, okay.
allergic reaction.
Okay, yeah.
And they're stronger.
Not
Okay, tongue depressors have a lot of uses, but they're a great smoking device. So, and they don't weigh up. Triangular bandages for any extremity fractures or dislocations of luxations, things like that, stabilize extremities. I carry a pocket mask, different splint materials. We talked about SAM splints and wire ladder splints. We can get to the point where we're taking too much stuff at some point. So we have to look around us if we need splinting materials and what we find in the area. Okay, then I talk about separating gels and liquids and keeping them contained in a Ziploc bag and protected between bandages. So if you do take a tumble or fall at your yard, compress that stuff and wipe out your first aid kit. And the coordinators, I think, need a cell phone or a spot locator. There should be at least one number. So does anybody have anything to add to any of that? Yes, ma'am.
just a backpacking hint. We were coming down from climbing a peak. One person was hypothermic. He was a doctor. And he started stumbling and not making sense. And because we had sleeping bags along, we could unzip the toe of the sleeping bag, pull it over him, so just his head was peeking out. The rest of him was encased in the sleeping bag. He could still walk, and we could support him on either side. And in not too long, he was warm again and all right.
And that just brings up a good point. It doesn't matter how much training you have, these things are very insidious. It can happen to anybody. So just kind of keep an eye on your fellow hikers and the folks that come along the trail and try to turn that around. And a lot of times you're fighting the light. It seems like when things happen, you need to get out. And if you can continue to move, that's a great thing to do. If it's serious and it's going down, we need to stop and correct that issue. Okay, that's about all I have. Okay.
Any other questions? Yeah, Larry?
Yes, sir.
Just wanted to ask, how many people here are now routinely wearing helmets? So maybe a third. And sometimes you see that they are required, but more often than not, they're just they're recommended. The scariest thing that I've seen on outings with GMS in groups, they inevitably get dispersed. Rocks come down in the strangest places. I've seen people get hit in the head. Thankfully, they've been wearing a helmet. But I just want to encourage everyone to start carrying a helmet on a more regular basis.
I agree with that.
And put it on. Absolutely right. You see people get hit by rocks, their helmet tied to their backpack.
I think there was an incident last year involving a particular medical person.
ER doc.
Who works in the ER as a doctor, and I think what I heard secondhand was the group was to the point of considering it was time to put on the helmets, but unfortunately, it didn't happen soon enough, and it resulted in a extended stop to try and stem the bleeding from this individual's head. So.
Doctor, the doctor is the case for.
He did it himself, but it did take time. Impression.
Is there any other comments, questions?
Kind of on that same note, don't think it's another hiker that's knocking a rock down, because I've had animals knocking on me.
You know, we actually, on that Gardner Point trip, there was one that we were in a couloir, and it was pretty tight quarters, and there was absolutely nothing we could determine that created this rock fall. Nobody was over there. It just fell, and it hit Rhonda on the hand. We were lucky that Jeff Young looked up just in time to yell, because it was something about this big, and it dropped maybe 30 feet straight down into the couloir.
I
Yes,
did?
we did.
Yay. I moved my hand and not touched it.
Wow.
Well, I wish you a really good climbing season.
I'll let Larry kind of announce our break and reconvening, but that was wonderful. Let's hope we don't have to use any of it, but it's better to be knowledgeable, like I said at the beginning, than not prepared. So Larry?
Thanks, Ron.
I just want to push the books one more time.
Oh, yeah.
Great book.
Are you going to be treasurer? If you want to buy the books during the break, Stephen will collect your money. It's $5, certainly worth it.
I sent out a list of some area restaurants. I don't know how many people here are